Safeguard Elderly in Economic Development is brought to you by Team Seed. We are economics master students in Nanyang Technological University of Singapore. During the pandemic, domestic resilience is more important than global competitiveness. We ask ourselves how to protect the local workforce while reserving healthcare resources for critical use. So we identified the elderly as the key factor within a community that causes the insecurity of these four needs. Safe family members, secured retirement, reduced hospitalization, and length of stay. This leads us to the Stay Home Elderly Care Program that aligns with the criteria under Pillar 3 in effective reporting, early detection, risk monitoring and assessment, as well as socio-economic planning.
This program integrates system and human service with terminal devices. In an emergency, the smart wearable device will transmit the GPS signal to the nearest health center without the use of the network. The connected health center can react immediately and effectively to treat the elderly without constant need for hospital visits during the pandemic. With the help of caregivers such as family members and CSR staff, the information of the elderly will be uploaded to the system. The caregiver is also responsible for responding to the elderly needs to help to purchase goods using the procurement system. The cloud platform collects emergency records and updates the health records of the elderly. By analyzing the available data, the government can be better prepared for the future pandemics. Here, we provide two options to develop the system. The first stage is for epidemic monitoring and emergency management. The advanced option can be developed into a comprehensive retirement and pension management system for the elderly. Now, let's see how this whole system works. In an emergency or if the elderly have some symptoms, the elderly can press the save button for help through the wearable devices. The GPS signal of the device will be transmitted to the nearest health center, and the operation staff of the health center will quickly contact the medical staff for assistance. It will greatly improve the efficiency of the medical assistance. When some potential threats arise, such as wearable device detects an elderly person falling, the early warning signal will also be transmitted to the assigned caregiver. The caregiver will approach the elderly to know the situation and then evaluate whether it is necessary to contact the health center. If the elderly have some special medical or material needs during the pandemic, they can also be collected and reported by caregivers to the system. And the caregiver can also help to purchase goods in the procurement system and help to deliver them to the elderly.
So there are two types of staff in the program. Christine, the administrator, and Ali, the caregiver. All staff can enter the system by the existing ministry website. Just click the newly added elderly on the far right. This is the page for Christine. The homepage shows the data of dial in and dial out and the to-do items of the call center, which she is responsible for. When the elderly presses the button of the wearable for 5 seconds, it will dial the nearest call centers or auto-match with next nearest call center until the phone is connected within minutes. The caller, Christine, will receive the location of the elderly so as to timely notify the health center for treatment. If necessary, Christine will also call the corresponding caregiver for guidance. On the other hand, the record conducted by caregiver during work will be updated in the system. Christine can also search the history records of work orders and the elderly hair care record. This is the page for Ali. On the My Elderly page, he can view the healthcare profile to assist the elderly. A red circle indicates early warning, such as fall warning and the involvement of health center. Meanwhile, a yellow circle reminds Ali to visit the elderly. The work order page emphasizes the specific information of the elderly with early warning and also show the status of tasks, status of delivery, door-to-door care, psychological assistance, and the medical reminder. The one-stop purchase page will help caregiver understand where to go and what things to buy more clearly for the elderly he is responsible for. The total cost of the system is $90,000 and the cost per wearable is $8. The development of the wearables are openly available in open source project. The SIM card is used to call for help with one press and send positioning, while the 6D gyroscope module can give an early warning of falling by sensing acceleration. The cost for 20,000 elderly is $160,000. For ease of reference, the total cost is $400,000 to equip all people over 65. Subject to budget constraint that only 20,000 elderly can be covered, the program will prioritize elderly who stay alone with limited internet access.
This program improved welfare of lives. We calculated the economic value of life savings in monetary terms with VOSL, the value of statistical life. Based on the framework proposed by Viscosy in 2020, the average VOSL in Fiji is $1.7 million. Using this as a foundation, we computed the VOSL for elderly based on additional data from WHO Fiji's life table and the 2017 population census result. To simulate the potential outcomes of our plan, we set 3 hypothetical death reduction targets, and the corresponding benefits range from $1.5 to $4.4 million. If we can incorporate the system as part of the post-pandemic new normal plan, we can save more lives due to the reduced hospitalization admission and length of stay. The medical resources are put into better use even during non-pandemic period. This provides flexibility to the healthcare team and allocate more time in research and development. The activation and readiness of the program are subject to the familiarity of the society towards the program. Finally, the benefit could be higher than estimation when the elderly is safeguarded during non-pandemic period. The following slides will show more details on our system interface, calculation, and analysis. Thanks for your watching.